Hi everyone, this is Neil Wright here, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a fungal ear infection, and we call that otomycosis. And more specifically, they had a strain of fungi called Aspergillus niger, and I will explain that in more detail in a moment. In addition to the fungal infection, they had this soft impacted earwax on their eardrum. And just to give you a bit of a case history, this patient has been suffering from a blocked ear for the last several months, and they have had, I think, 2 or 3 unsuccessful attempts of having microsuction performed elsewhere. The last specialist that they saw recommended that they see myself, and the reason for that is the specialist and the previous specialist just weren't comfortable going really deep into the ear, up against the eardrum. I don't see that as a negative. There was once upon a time when I first started, I was a bit afraid of going so close to the eardrum, naturally, because you don't want to be causing any injury or trauma, or in the worst case scenario, even perforating the eardrum. And it does take a bit of time and experience. So these specialists did the right things, and no doubt over the years, the more procedures they'll do, they'll get more confident going deeper and closer to the ear. I've removed the majority of the debris off the eardrum. There's a bit of dead skin left in there, and we are going to come back in a moment to remove that, but already they can hear significantly better. And so this Aspergillus niger, it counts for about 70% of fungal infections in the ear. The remaining 30%, give or take, is a strain of fungi known as Candida. Candida is a bit more difficult to diagnose and distinguish because it normally presents itself in a thick, creamy secretion, discharge. However, a lot of bacterial infections also present in the same way. But with Aspergillus niger, it's clear to see, it's very identifiable because of the spores and the woolly strands. Now, it's not going to be possible for me to remove every little last speck of spore and strands, and there are going to be some, even if we can't visibly see, still present in the ear. So this patient does require antifungal treatment. I've written to their GP, and in the meantime, I've recommended an over-the-counter antifungal ear solution that they can use. To be honest, it's very similar, if not this identical to what the GPs will prescribe, but I have written to the GP nonetheless. Now, with fungal infections, they are difficult to overcome, and these drops are normally used for a fortnight, and I've asked the patient to return to the GP after a fortnight just to make sure that the fungal infection has successfully been treated, because if not, they will need to continue the antifungal drops. And the patient does regularly use medical grade olive oil spray in the ear, and I advise them not to, because if you have got a fungal ear infection, they strive and can exponentially reproduce in the presence of olive oil, because the fungi actually feed on it. So although you feel that you're doing the right thing, and instilling medical grade olive oil spray can be beneficial to a lot of people, but in the presence of a fungal infection, strongly advised to not do that. In addition, the patient has advised me that they've got water in the ear recently whilst on holiday. That's probably a trigger for this. Fungi infections in the ear typically occur in warm, humid, moist conditions. So getting water in your ear is going to provide the perfect breeding ground for not only fungi but bacteria to thrive and reproduce and colonize the skin that lines the ear canal. So that's where they inhabit, and sometimes they can actually inhabit on the surface of earwax and feed off it.